So today we are going to see the arterial anastomosis on the back of the thigh. So first of all, we need to know the basic ideas about the arteries on the back. So this is the abdominal aorta. Abdominal aorta, as it passes downwards or as it descends downwards at the level of L4, it is divided into two common iliac arteries. That is, this is the right common iliac artery and the left common iliac artery. Okay, and the right common iliac artery, as it descends downwards, it is again splitted into the external iliac artery and the internal iliac artery. Okay, external iliac artery, after going or passing the inguinal ligament, it is known as the femoral artery. It is called as the femoral artery. Okay, after passing the inguinal ligament, it descends as a femoral artery, and after passing the knee joint, it is named as the popliteal artery. So, this is the abdominal aorta. At the level of L4, it is divided into right and left common iliac artery, and the common iliac artery, as it descends downwards, it is again splitted into external iliac artery and internal iliac artery. After external iliac artery, after passing the inguinal ligament, it is called as the femoral artery, and femoral artery after passing the knee joint, it is called as the popliteal artery. Okay, this is the popliteal artery. So now we are going to study the branches of these arteries. So this is femoral artery. This is the femoral artery. Okay, femoral artery has the largest branch called as the profunda femoris artery. This is the profunda femoris artery, and profunda femoris artery, it is again divided into, this is the lateral circumflex femoral artery, this is the medial circumflex femoral artery, and it has four perforating arteries. These are the four perforating arteries. This is first, second, third, and fourth. Okay, profunda femoris artery, this is profunda femoris artery, that is the largest branch of the femoral artery, and it has lateral circumflex femoral artery, medial circumflex femoral artery, and the four perforating branches. Okay, this lateral circumflex femoral artery, it is divided into, this is the ascending branch and this is the transverse branch. Medial circumflex femoral artery, it is also divided into ascending branch and descending branch. This four perforating arteries are also divided into, this is ascending, descending, ascending, descending branches. Okay, that is clear, I think so. Then comes the internal iliac artery. So internal iliac arteries are divided into two. Okay, that is the inferior gluteal artery. This is the inferior gluteal artery, and this is the superior gluteal arteries. Okay, these are the descending branches of inferior gluteal artery and superior gluteal artery. Okay, then the popliteal artery gives off a branch called as a superior muscular branch of popliteal artery, and it gets anastomosed with the fourth perforating branch of the profunda femoris artery. Okay, here one anastomosis occurs. Okay, so then now we are going to see the anastomosis, three types of anastomosis on the back of the thigh. So the first anastomos is the longitudinal anastomosis, and the second is the trochanteric anastomosis, and the third is the cruciate anastomosis. So longitudinal anastomosis is the main arterial supply to the back of the thigh. Okay, so this is derived. This is the longitudinal anastomosis. Here occurs the longitudinal anastomosis. So longitudinal anastomosis is derived by the ascending and descending branches of the perforating arteries. So these are the perforating arteries. Perforating arteries, after piercing the adductor magnus of the thigh, what happens is that they forms ascending and descending branches, and these ascending and descending branches gets anastomosis, and these are called as the longitudinal anastomosis. Then comes the trochanteric anastomosis. So longitudinal anastomosis is formed by the ascending and descending branches of the four perforating arteries. Okay, then comes the trochanteric anastomosis. The second form of anastomosis is the trochanteric anastomosis. Why it is so called? Because it occurs in the trochanteric fossa. Okay, the trochanteric anastomosis appears in the trochanteric fossa. Okay, and this is formed by the four arteries. What are the four arteries? That is the ascending branch of the medial circumflex femoral artery, ascending branch of lateral circumflex femoral artery, descending branches of the inferior gluteal artery, and descending branch of the superior gluteal artery. That is the ascending branch of lateral circumflex femoral artery, the ascending branch of medial circumflex femoral artery, and the descending branches of the gluteal arteries. That is the superior gluteal arteries and inferior gluteal artery. that forms the trochanteric anastomosis. And cruciate anastomosis, it occurs at the back of the femur at the level of the lesser trochanter. Okay, so that is cruciate anastomosis. It is also formed by 4 arteries. What are the 4 arteries? That is transverse branches of medial circumflex femoral artery, transverse branch of lateral circumflex femoral artery, and ascending branch of first perforating artery and descending branch of the inferior gluteal artery. That is the transverse branch of lateral circumflex femoral artery, the transverse branch of medial circumflex femoral artery, and the ascending branch of first perforating artery, and the descending branch of inferior gluteal artery. So these are the 3 anastomoses. Longitudinal anastomosis formed by the perforating arteries after passing or after piercing the adductor magnus, and the trochanteric anastomosis is formed by these 4 arteries, that is the ascending branches of the medial and lateral circumflex femoral artery and descending branches of the superior and inferior gluteal arteries. And the cruciate anastomosis is formed by the transverse branches of the medial and lateral circumflex femoral arteries, ascending branch of the first perforating artery, and descending branch of inferior gluteal artery. So that much is about the arterial anastomosis of the back of the thigh. I think you made it clear, and thank you.